Hi, I'm Sheena Black. I am an orthopedic surgeon specializing in sports medicine at Baylor Scott & White Health. Let's talk about shoulder pain. Injuries to the shoulder are not limited to sports and athletics. They can happen in everyday life. Here's what you need to know to live well and free of shoulder pain. Taking steps to prevent a shoulder injury is the best way to avoid the need for a shoulder procedure. This starts with keeping the shoulder stabilizer muscle strong and using appropriate form. In addition, it is important to avoid activities that place your shoulder at risk for injury, such as excessive overhead lifting or improper workplace ergonomics. Proper technique should be stressed during athletic activities involving the shoulder, and appropriate warm-up, stretching, and adequate rest can help to avoid injury. Shoulder injuries are pain that doesn't improve with prolonged at-home care such as rest, ice, or over-the-counter anti-inflammatory medications most likely needs to be evaluated by a physician. Oftentimes, patients first seek care because their shoulder is causing discomfort at night, making it difficult to sleep. Other signs that warrant an evaluation by a specialist include the inability to raise your arm overhead, decreased shoulder range of motion, shoulder weakness, and numbness or tingling in the arm.